Breaking the Barriers of Stigma. We're so glad that you joined us. My name is Corey Wise. I'm a large group wellness coordinator here at Florida Healthcare Plans in the Health Promotion and Wellness Department. Our guest speaker today is Karen Sharpick. She is the Executive Director of Volusia Recovery Alliance. Karen has been in long-term recovery herself and has a passion for helping individuals struggling with the self-destructive cycle of drug abuse. Karen will share more about Volusia Recovery Alliance during her talk and how we can help support individuals by reducing the stigma around addiction. Karen, thank you so much for being with us today.
Good afternoon, everybody. We can go to the next slide. So, as Corey mentioned, I am a person in long-term recovery, and what that means for me is that for the past 40 years, I have not used alcohol or drugs. I've been in a recovery program, a pathway of my choosing, and I'm very passionate, as she mentioned, about helping others recover from substance use disorder. And I believe that recovery is possible for anyone who wishes it, as well as my favorite saying being, where there's breath, there's hope. Because often this is a disease that people return to use quite often, but ultimately recovery is possible. I'm married to a man that had 21 treatment failures, and today he's been in recovery for 38 years from heroin use. So we can go to the next slide. Our objectives today are to define substance use disorder, which we're going to just call SUD moving forward, learning about the impacts of SUD, defining stigma, learning how language choice can reduce stigma, and learn what to do and know about some recovery resources for someone with SUD. Next slide. So SUD is a brain problem. It's a brain disease because drugs affect the brain, and it actually causes long-term changes to the brain, which, because of neuroplasticity, can be reversed when you enter into a recovery path. So SUD is a chronic relapsing brain disease. Drugs directly or indirectly affect the reward pathway in the brain with dopamine release. Dopamine is a neurotransmitter that is produced in the body and affects people's moods. And the part of the brain that is affected starts in kind of the lower part of the brain, but it ends up in the prefrontal cortex, which is where decisions are made in your brain. So that's why people that use drugs often don't make good decisions, because that prefrontal cortex is affected by the disease of substance use disorder. So some of the characteristics of someone with substance use disorder is compulsive use, loss of control, continued use despite consequences, which is actually a key indicator of the disease. Tolerance. Tolerance is when someone uses one pill today, the longer they use, the more drugs is going to be necessary to get the same effect. That tolerance also works in reverse when you take away the drugs. Hence, why many people that go to treatment or go to jail and they are removed from the drug use, they return to use, and it takes less of the drug to affect them, and they go into an overdose, and often they die from an overdose death. And then withdrawal. Withdrawal means that if you take away the drug or stop the kind of behavior that can be, addictive, so to speak, the person will feel an adverse effect. It could be emotional, it could be spiritual, or it could be physical. Next slide. So we know today that substance use disorder and trauma are very much related. Trauma influences the brain. It actually causes changes in the brain as well. And people often use to feel better from the trauma that they've experienced. Humans are hardwired to engage in reward behavior. However, unfortunately, the brain doesn't realize that some of the behavior that initially feels good results in becoming dependent. Because of the way the brain works, that's what happens. It's like somebody that likes chocolate chip cookies, for instance, and they know that every time they eat chocolate chip cookies, it feels so good, it tastes good, and it makes them happy. Well, that's a result of the sugar that's affected in the reward pathway. Tobacco is actually the gateway drug because it primes the reward pathway to respond easier to other drugs once you add them to the mix. So our bodies respond to threats going back to the dinosaur age, actually, with fight, flight, or freeze. And that means that either some people respond to stressors by fighting. Those people that respond that way typically will, they end up dying from stroke or heart attacks. An example of that was my dad. He was the one that was mad most of the time, and he unfortunately died of a heart attack after many strokes. Or the freeze people are the warriors. And that was my mom. And as I was sharing with Corey earlier, my mom died of pancreatic cancer. And then flight, that means, you run away. So those are stress responses. And the body kind of learns how to respond to stress in those three ways. A lot of people do try to kind of fix themselves by using drugs. As a person that grew up kind of mellow and heavy, my drug of choice typically was stimulants because I wanted to be up. I wanted to be, engaged. I wanted to be successful. I was very driven and I wanted to be skinny. And so typically I went down the path of stimulants, not necessarily sedatives or opioids. Next slide. So this is a PET scan of a brain. On the left, side of the screen is a normal brain. Those areas of red are areas of brain activity. And when you introduce cocaine to the brain, you'll see that those areas have diminished. And as I mentioned, the neuroplasticity means when you come off the cocaine, your brain can heal. And those areas of activity will come back. It typically takes a good year to heal the brain, which is why the first year of recovery is very crucial to giving people support in their early recovery. Next slide. So there are a lot of consequences and costs of substance use disorder. In 2021, there was 100,000 overdose deaths in the United States. In 2022, that number went up to 107,000 deaths. Every 25 minutes, an American baby is born with exposure to opioids. Alcohol in the womb is even more detrimental to babies, as a matter of fact. Volusia County in 2022 actually had 297 overdose deaths. 32114 is the hot spot in the county for deaths. And we know that, Narcan has saved a lot of people because there's been way more overdoses than there are deaths. So from an employer perspective, illicit drug users typically miss 2 or more days of work per month. Their impairment may really affect company morale, and a lot of times people aren't even aware of the reason why. It's because of drug use. Typically, drug users have worked for 3 or more employers in a year, which, as you probably may know, that the effect to the bottom line from losing employees is very expensive because it takes a lot to onboard people and to train them and to pay all the recruitment costs and all that. We know from Dr. Murthy, who's our current Surgeon General, that for every dollar spent on treatment and recovery support, there's a savings of $11. $4 of which are medical costs and $7 of which are criminal justice costs. So currently in First Step Shelter, 70% of the residents there, it's the homeless shelter in Daytona, have substance use disorder. And then as many as 60% of adults in federal prison are there for drug-related crimes. Next slide. So there is a hidden story underneath substance use. What you don't see is childhood trauma, mental health issues, abuse in the realm of physical, emotional, and sexual, poverty, loneliness, grief and loss, and then pain. I myself started my path on drug use with chronic pain. As an 11-year-old, I had bad knees, and the doctor gave me Percocet, which is an opioid, and I was off and running. And then I also got diet pills from a doctor because I was a chubby little kid. I used to say I was 5 by 5, right? Next slide. So what is stigma and why are we talking about stigma? Well, stigma is the number one barrier for people going into recovery. It's a mark of disgrace or infamy, a stain or reproach on one's reputation. Next slide. There's 3 different types of stigma. One is public, which is discrimination and devaluation of others. It's stigma coming in this way. Then there's systemic stigma, which is reduced access to care and resources due to policies about people that either have substance use disorder or mental health issues. Things like renting an apartment to someone with a felony falls under this category. And then it's stigma coming in. It's self-perceived, the internalization of negative stereotypes. Part of my story is a stigma story. I was a candidate for recovery at the age of 20. I was already a healthcare professional. I'm a respiratory therapist by background. I was very well respected, and I knew I was getting in trouble with drugs and alcohol, but yet I was too afraid to ask for help. I didn't want to be judged. I didn't want to lose my job. And so I used for another 9 years, and it derailed my dream of becoming a doctor. Next slide. So language matters, and we ask that people not say drug abuse, that we use person first language, such as I'm a person with substance use disorder, I'm a person in long-term recovery, instead of addict, addiction, dirty, former addict, getting clean would be, a person in recovery. Clean and sober as opposed, say substance free. Treatment is the goal. Say instead, treatment is one pathway to recovery. There are multiple pathways. Opioid replacement or opioid management, say medication-assisted treatment. And relapse, say instead recurrence or return to use. Next slide. So again, say this, not that. Don't say you're so selfish. Don't say I give up. You'll never beat this addiction. Recovery is possible and should be expected. You're doing it wrong. Recovery has to be done this way. There's multiple pathways. You can say instead, you've changed, give concrete examples of what you see the changes are. Let the person know I care about you. Let them know you're not alone. Let them know everybody needs help. In fact, every human being at some point in their life needs help with something. It may not be recovery, but it may need, maybe you need help with grief or whatever. And then say, how can I help? Next slide. I do want to also say quickly, I got to meet Dr. Murthy at the White House, and he made the statement that the best medicine of all is love and compassion. And every one of us has the opportunity to treat a difficult person that way. So the recovery movement is alive and well in Florida. We are part of a statewide recovery community organization known as Floridians for Recovery. Recovery community organizations are independent nonprofits led by people in recovery. We organize recovery-focused policy. We do through advocacy. We carry out recovery-focused community education and outreach programs. We build recovery-friendly communities, which is what we're trying to do in Volusia County. And then we do a lot of Narcan distribution outreach. Narcan is a reversal drug for overdoses. And one thing that you might not be aware of is there is a new drug that they're combining poisoning street drugs with, in addition to fentanyl, which does respond to Narcan, but it's a drug called xylazine, and it's a horse tranquilizer that there is no antidote for humans. Pretty much the person has to go on a ventilator and wait until the drug is metabolized. But it does cause a lot of wound issues. At one point, they were calling it crocodile because people's skin would kind of turn out looking that way. It's really a nasty drug. In last year, we had 22 deaths that involved xylazine. Next slide. So the Volusia Recovery Alliance is your local recovery community organization. We came together in 2019 through a grant from the Aetna Foundation. And we've been doing the recovery of putting out recovery resources since 2019 when we became a 501c3. So today we do operate our Hope Hub Resource and Engagement Center. It's in Ormond Beach in the old Penny Saver building, and we're open to the public Monday through Friday, 1 to 5, and the other times we're available by appointment. If somebody needed Narcan, they could come to the office and pick some up. Our trainings include overdose response and reversal. When we do that, we give out free Narcan to go along with that particular training. Other trainings, we can do trainings like this anywhere from a half an hour to 3 hours. The 3 hour is the most comprehensive. It goes into a lot more brain stuff. It's very comprehensive, and it's the training that I do for the new deputy recruits from Sheriff Chitwood's organization. Other things that we offer is peer support. Peer support is one-on-one recovery coaching with someone that has lived experience in their own recovery. We spend a lot of time linking people to the services and resources they need to either start their recovery or maintain it. And that includes families. So we operate some specialized meetings. One is a parent cafe for parents that need to develop the skills to be better parents. Recovery Connections for Dads is one that we came up with after we realized that there weren't a lot of resources for dads in recovery. Both of them are based on ACEs score, which ACEs stands for Adverse Childhood Experiences, and we teach them about protective factors on how to be better parents. And the biggest thing that happens at those meetings is connection with each other. They support each other. The opposite of the disease is connection. And so tonight at our Hope Hub, we have Bridge for Hope, which is a overdose grief support group in collaboration with Halifax Hospice, led by Dr. Kim Beck-Freight, who is a hospice therapist. We also offer Invitation to Change, our family support group, which is based on science and kindness, and that happens twice a month. A Window Between Worlds is an art alternative group that happens twice a month as well. We offer 12-step yoga once a month. We have an ongoing contract with Career Source Flagler Volusia to help people in recovery, their families and allies to find a new career path. It comes with career development assessments. It comes with kind of immediate help to find a job, or Peer recovery training is part of the program. So if somebody wanted to become a recovery peer specialist, they can use that program as well, and we pay for the training. And we also do a lot of work with people that need exemptions. And then we do advocacy. Next slide. We've helped change some laws that help people in recovery. So what can you do? You can share that there is hope, recovery is possible. There is freedom, there is recovery, there's a new way of life, a day at a time. And next slide. So before we open it up for questions, I just really want to thank you for your attention, but I really want people to know that recovery is definitely possible. I've also recovered from an eating disorder. My life has completely changed from when I first came into recovery. I've been able to give back. I'm a voter. I'm a homeowner. I've been in a long-term marriage with my husband who had all those return to uses. But we have a relationship based on respect and love. And, I'll quickly tell his story at the end. His family was they were cutting him off and they were disgusted with his behavior. And they basically told him, you're hopeless, you're helpless, you're never going to get this. And we're done with you. And they left. And one nurse came into his, that was taking care of, came in and sat on his bed and looked at him with compassion in her eyes and said, Shirley, you can figure out, Shirley, you can let me know what you could do to help yourself. And he said, maybe Narcotics Anonymous. And she said, well, Bob, I'll get somebody from that fellowship. And that night somebody came in and he's been in recovery since that day. And he has helped thousands of people. Today he's a drug counselor at Break the Cycle. And he's helped, in his own pathway, he's helped thousands of people. So with that, we have about 6 minutes left. I'm happy to answer questions. I just really want to thank Florida Healthcare Plans for the opportunity to be their partner. We are here for you. We are here for your families to help against the battle against substance use disorder. And our goal is to end overdose. So thank you very much.
Thank you, Karen. At this time, if anybody has any questions, feel free to put them in the chat, or you can unmute your microphone if you have one, and ask Karen your question. Karen, a thought came up between sessions today. Are there any drug treatment seems a little bit reactionary, I guess. Are there any preventative things that can be done, people can do to maybe help their family members, their children?
Yes. So it's really important to get educated. So one of the websites that has a lot of great information is the SAMHSA website, which is I can never remember it, but SAMHSA, which is the federal government, it's samhsa.gov. Mm-hmm. They have tons of information on there, but education is one really big protective factor. Open and honest communication with family is so important. So having dialogue with your children is one way to set them up for success. Developing good coping skills. So instead of, like exercise, promoting exercise, promoting art, promoting music, the different things that make you feel good naturally, because we're set up that we want that dopamine, right? So dopamine levels can increase by art, by music that's meaningful, by having a good meal that's, not full of sugar, eating healthy, all those things that, thank you, that it's SAMHSA
Right.
is the website.
There it
And
is.
so
Thank you, Brittany.
really knowing more about people's challenges, letting people know that you love them when you feel that way, is so important. And and learning about the protective factors. So protective factors include community, they include support, they include things like building resilience. And what resilience means is that, you know, you may fall down 10 times, but you get up 11 times. Mm-hmm. So doing things that build resilience is so important, and it is one of the protective factors. So I'm all about learning about protective factors because it's really helpful.
All right, great. Well, I'm not seeing any questions, but Karen, it was a great presentation. Thank you so much again for joining us. There's Karen's contact information on the screen if any organization is interested in speaking with her. We've had a great working relationship with Karen, and so we look forward to continuing that. Thank you all so much for being with us today and joining our webinar, and I hope everybody has a great rest of your day and great rest of the week. Thank you.